This is the big danger of losartan. In this video, I'm going to tell you everything about losartan, what they don't tell you, how it works, what the benefits are, the risks, and two major dangers that could put your life at risk. And when I say put your life at risk, I'm not exaggerating. It's not just a figure of speech. This really can happen. And these are serious dangers that can seriously affect your health and your life. So pay close attention because you should never do these two things. All right, so let's talk a little about losartan. Losartan is currently one of the most frequently prescribed medications in the entire world for treating high blood pressure. It's a medication from the class of antihypertensives and works to lower blood pressure. But why this medication? Is it so widely prescribed? Is it so well known? The first reason this medication is one of the most prescribed in the world is that it's low cost, its patent has expired, and several pharmaceutical companies can produce it. And sometimes it's even distributed for free. This is really important in long-term, ongoing treatment because the cost will directly affect adherence and whether or not the person will be able to buy it. So the first point is that it's low cost. Second, this medication is widely prescribed because it's been extensively studied. It's a medication with a lot of studies showing its benefits, many studies showing how it should be administered, what the dosage is, and its safety profile. So this is really important, the scientific studies. And losartan is a medication with a lot of studies, so it's considered safe and well known, widely recognized by doctors. And third, it has few side effects. Many people tolerate this medication well, without experiencing any side effects that would lead them to stop taking it. That's another point to consider. So these three factors, few side effects, safety, and low cost, already give you an idea of why losartan is so widely prescribed, really. And how does losartan work? And what is this medication used for? Losartan belongs to the class of angiotensin II receptor blockers. What does that mean? I'll break it down to make it really clear here. What does angiotensin do? It acts on the contraction of blood vessels, on peripheral vascular resistance. It works in the kidneys by reabsorbing sodium and water, and it also triggers the release of aldosterone. So, if we have a medication that blocks these receptors, then how does losartan work? Losartan functions by helping to relax and dilate your blood vessels, which effectively lowers your peripheral vascular resistance. This process is incredibly important for managing your blood pressure. If your blood vessels are more relaxed and open, your heart doesn't have to exert as much effort or strain to pump blood throughout the body. It can perform its job much more easily, to put it in simpler terms. Additionally, losartan also acts directly on the kidneys by significantly reducing the reabsorption of both sodium and water into your system. So losartan also works on this issue of water and sodium. And what is it used for? Well, for high blood pressure, as we already know, but losartan. It's also often used to protect the kidneys. For example, diabetics who are losing protein, there's scientific evidence that losartan can help. People with high blood pressure who have kidney damage because of hypertension as well. That's another factor we should consider. Losartan can function effectively by actively reducing or even preventing the heart from becoming overly muscular or enlarged, effectively preventing what we commonly call cardiac remodeling, left ventricular hypertrophy. When the heart has to pump blood at high pressure, it can become muscular. You've probably heard this expression before. It's called cardiac hypertrophy, and losartan can help with that. Losartan will also help with this sodium issue. And losartan can control and lower your risk of having a heart attack, a stroke, and other cardiovascular complications. And also heart failure. Losartan can help with that too. So there are several factors. You didn't know that, did you? Many times, the doctor just keeps focusing on blood pressure, but there are all these other studies that make losartan a safe medication with many uses. So now you already know how it works, how it acts. It gets absorbed. When you take it, your liver metabolizes it, and then your kidneys eliminate the losartan. And what are the side effects? This is really important. Before I talk about the risks, so you can start understanding how losartan works, I just want to ask if you're enjoying this video, if it's been helpful talking about this medication. So right here, if you take losartan or not, or if you take another medication from the same class as losartan, like valsartan, candesartan, or olmesartan, and valsartan, write down for me, too, which part of the world you're from. Okay, let's keep going here with the side effects of losartan. What are the secondary effects? Most of the time, losartan's going to be well tolerated, but in some patients, we have a complication called angioedema. What is that? Swelling of the lips, throat, your face, your whole face, a very serious reaction that requires immediate discontinuation of the treatment. It's always one of the risks we worry about with losartan. It's pretty rare, but I have to point it out here. It's actually more common with other medications, but it can happen with losartan too. Just so you have an idea how rare this is, in the 15 years I've been prescribing losartan, I've seen it happen twice. So it's rare, but you need to be aware of this side effect. So if you experience swelling in your face or lips, or have trouble breathing, you need to seek immediate medical attention. If you just started taking losartan, that's one of the possible side effects. Feeling tired or fatigued, this can happen in up to 10% of patients. Dizziness, and here I want to point out that losartan can lower your blood pressure too much. This is unlikely to happen if the medication's properly prescribed, but it can occur, especially in people who already have orthostatic hypotension. When you stand up, your blood pressure drops and you feel dizzy. This is especially true for elderly people, so you need to be careful and assess this beforehand. That's why you need to monitor your blood pressure. It can cause low blood pressure, but that's also pretty rare. Losartan, because of the way it works, as I mentioned earlier, you remember when I mentioned sodium, that it prevents sodium from returning to the body? So, to do this in the kidneys, it can raise potassium levels a bit, which is actually called hyperkalemia. That's when the potassium in our body goes up, okay? You need to pay special attention here, especially if you already have high potassium levels, all right? Anyone who already has hyperkalemia or already has weak kidneys. You need to be careful because with losartan, this can get even worse, okay? So you need to monitor potassium levels in the blood. That also needs to be done. Another situation that requires a lot of caution is women of childbearing age. Not just those who want to get pregnant, but those who could become pregnant. You have to be very careful because it can cause changes in the baby, all right? As a doctor, personally, I avoid it in these situations. There are other medications that are safer in these cases. Another major precaution we need to take with losartan is in patients who are dehydrated, who are vomiting, for example, who have acute kidney failure, or who have what we call bilateral renal artery stenosis, or only one kidney with this stenosis. Prescribing losartan and other medications from the same family can make this issue even worse. Well, so there are several issues that the doctor needs to evaluate, which is also why self-medicating is so dangerous. You all know here on the channel, I always say this, that self-medicating, even if it's with an effective, well-studied medication, can involve a lot of different situations. Just look at how many I've already mentioned here, and there are many more. We'll talk about them too, but you really have to be careful with those situations like, oh, so-and-so recommended this medicine to me, or someone else did. So always make sure everything is properly evaluated. All these points I mentioned here, okay? And now, what are the two dangers? I mean, these are fatal dangers that can really lead to very serious consequences. You'll understand why. Well, the last danger is a combination, another class of medications that you can't use. So stick around until the end so you can understand this. The first danger when using losartan, and this one is the most common, okay? I don't have exact statistics on this, but talking to patients, I see that it's a big mistake that can compromise your entire treatment, which is believing too much that only losartan will solve everything. And why is this so dangerous, the magic pill? Because losartan won't address what caused your hypertension. It won't affect your habits, for example. It won't help reverse your weight. It'll work on that mechanism I mentioned earlier. That's very good for lowering blood pressure, yeah. But if you don't take the other steps, what's going to happen? You'll take losartan at your next appointment. Maybe your blood pressure will be fine, but in the coming years or even months, what's going to happen if you don't? If you don't take steps to control your blood pressure, it just gets worse. The doctor will have to add another medication, will have to increase the dose of losartan, then add another medication, and then another one. And before you know it, you believe that was going to be the solution, but in reality, you're just making things worse. That's not the medicine's fault, it's because no one explained it to you. About this danger that, along with medication, the medicinal treatment, which I'm not against, okay? On the contrary, I'm actually in favor of it. When properly prescribed, medications really can help you, but you also need to take the steps that'll actually work to lower your blood pressure. You have to understand the cause, because it's no use taking losartan and then having lunch, eating salami, eating instant noodles, adding a lot of salt to your food, only eating packaged foods, or using artificial sauces that are high in sodium. In that case, losartan just won't cut it. On the contrary, you'll actually get worse. Then you'll be left with that idea. Oh, losartan didn't work. I want another medication. When in reality, what you need to do is make these changes, which I'll explain to you more about later, too. Just a second, Danger. And this one, honestly, is really serious. And I've seen a lot of patients using it. This involves combining losartan with another very similar type of medication, which will also interact in this exact same matter, effectively increasing your potassium levels. Now, what other specific class of drugs do we have here, which is a class that is strictly considered not to be used together according to the guidelines from the American Heart Association? Those would be the ACE inhibitors. Wait, but which medications are those? They're prescribed a lot too, right? Captopro, lisinopril, ramipril, and allopril. These specific types of medications that end with the suffix pril, if they are taken in combination with other angiotensin II receptor blockers, they can actually cause a very serious consequence within your body, which is a significant and dangerous increase in your potassium levels. Of potassium, they won't lower your blood pressure and they'll still put you at risk of high potassium, which can harm your kidneys by increasing potassium levels. And what's the problem with having high potassium? In the blood, hyperkalemia increases your risk of arrhythmias, for example. So, in trying to control it, sometimes the patient comes to the appointment with high blood pressure, and he's already taken losartan or another medication, but he didn't bring the prescription, he didn't bring the medications, and he doesn't really remember the name. And many times the doctor tries to figure it out. What medication is it? And then the patient feels a bit embarrassed for not remembering, ends up agreeing, and this has happened several times before. And when the patient agrees, the doctor really doesn't know which medication it is and ends up prescribing other drugs that shouldn't be prescribed, along with losartan. So the message here in this video is always bring your medications. You always have to bring your prescription. And if you're using these two classes of medication that I mentioned here in the video, you need to talk to your doctor as soon as possible. That's why it's well documented in the protocols of the American Society of Hypertension and Cardiology as well. There are extensive studies that show these effects. That's it. When you talk about other antihypertensive drugs, like amlodipine, for example, which are calcium channel blockers, or medications that are diuretics like furosemide or hydrochlorothiazide, then yes, we have well-documented and very safe combinations. Well, what I said about that combination applies only to the group I mentioned, okay? The others can, in fact, be combined, beta blockers, for example, and there is scientific evidence that in many cases, this can even further improve your treatment. So let's not get confused about the topic of the video. Yes, there is indeed safety with these other medications. In fact, several studies have already shown this association. When we talk about losartan and other medications from the same family, for example with olmesartan, studies have shown that they have some small differences. For example, when we compare losartan with olmesartan, the half-life can change a bit. What does that mean? It's the number of doses you'll need to take throughout the day. So losartan can indeed be taken once a day, but preferably twice a day. Because of the medication's half-life, right? It's eliminated, the half-life, in about 6 to 9 hours. So many doctors prefer to prescribe it twice a day. But with olmesartan, that's not the case. It's just once a day. Because of the way the medication is eliminated, studies have also shown that olmesartan is a bit more potent. There are some other medications in the same class that have slightly fewer side effects than losartan. It's important to point out that these are from the same class. Another study also compared valsartan with losartan, and in that specific study, valsartan lowered blood pressure a bit more. For patients with heart failure, that's another point to consider. So we saw that losartan does have its benefits. It's a very good medication. I've actually prescribed it a lot myself. I'm not against losartan just because I talked about the risks here, okay? Let's not misunderstand the video. And yes, it's a safe medication when properly prescribed, when well combined with other medications, and when the risks are explained to the patient as well. You've already seen what the first risk is. If you want me to make a video about another medication, write it here in the comments and I'll prepare a video. Also, I want to know what rating you'll give this video from 0 to 10. If it's a 10, I'll make more videos like this one. Who knows, maybe a part 2. Just comparing angiotensin receptor blockers, losartan and the others in the same family. What do you think? I think that's a pretty cool topic, don't you? Like I did at the end there, just focusing on the scientific studies. Now, I'm going to leave you with a suggestion to watch. It's a video where I talked about ways to lower blood pressure. Here, you'll be able to avoid the number one mistake. It's the number one danger. You'll understand how it works and what you really need to do to effectively control your blood pressure, to manage high blood pressure. If you want to know, then click on this link. Here you'll be directed to that video. Take care. See ya.